We quickly do hyperkalemia to end this series. So hyperkalemia is potassium level that is higher than 5.0 millimoles per liter. Blood potassium level that is higher than 5.0 millimoles per liter. That's hyperkalemia. And so symptoms, when we talk about symptoms, most people do not experience symptoms until the potassium level gets up to as high as 7.0 millimoles per liter. However, symptoms can occur at lower levels if there is a sudden rise in potassium level. But if it's a gradual rise, if it rises gradually, the individual may not experience symptoms until potassium levels get to 7.0 or above. So symptoms include neurologic symptoms. You have the musculoskeletal symptoms, you have the gastrointestinal symptoms, you have the cardiac symptoms. So we begin with neurologic symptoms. Neurologic symptoms of hyperkalemia includes decreased reflexes. When the person is supposed to express or exert a reflex, is not able to exert it when he should exert it. So decreased reflex, tingling, as well as numbness of the extremities, such as the fingers and the toes. Then you have the musculoskeletal symptoms, which include muscle weakness and paralysis. You have the gastrointestinal symptoms, which include the abdominal gas and bloating, nausea, diarrhea, as well as vomiting. Those are cardiovascular, gastrointestinal um, symptoms. Then you have the cardiac symptoms, which include the reduced heart rate, palpitations, cardiac arrhythmia, chest pain, as well as cardiac arrest. All these are symptoms of hyperkalemia. So when potassium becomes too high, it has its own negative effect. Now let's really look at the causes. What are the causes of hyperkalemia? Now, hyperkalemia can be caused by ineffective elimination. It can be caused by excessive release of potassium from the intracellular compartment into the extracellular compartment. Remember that we said that the potassium that we measure is the extracellular potassium, and it is when the extracellular potassium is high that we can see there is hyperkalemia, and it is when it is low that we can see there is hypokalemia. So excessive release of potassium from the intracellular compartment to the extracellular compartment can cause hyperkalemia. Now, another cause is excessive consumption of hyperkalemia, of a potassium-rich diet. When one begins to eat diet that is rich in potassium in excess, it can result in hyperkalemia. Then also there is what is known as the pseudo hyperkalemia. That means the false hyperkalemia. So we'll talk about them, each of these causes, one after the other. We begin with ineffective elimination. Now, this has to do with the rate at which potassium is cleared out of the system. If it's ineffective, it can cause a buildup of potassium in the circulation and can result in hyperkalemia. So first, decreased kidney function is a major cause of hyperkalemia. Now, where there is maybe an acute kidney injury and there is a reduction in the rate at which the glomerulus filters content into the um, renal tubule. Now, this can result in accumulation of potassium, and this is mainly characterized by reduced urine output. So urine volume will be very low, and there will be accumulation of a lot of electrolytes, including potassium. Now, in chronic kidney disease, hyperkalemia occurs as a result of reduced aldosterone responsiveness, as well as reduced sodium in the circulation and watery deliveries in distal um, tubule. So now, that means that aldosterone is available, and because because of the renal damage, the tubules are no longer sensitive to aldosterone. the receptors, they are no longer responding to aldosterone. And you remember that aldosterone is supposed to facilitate the reabsorption of sodium in exchange for potassium. So potassium will be secreted into the glomerular filtrate to be passed out in urine, and then sodium will be absorbed. But when there is unresponsiveness to aldosterone, the tubules will not allow sodium to be reabsorbed, and so potassium will be retained in circulation, and that will cause hyperkalemia. Then also, in certain the use of certain medications that interfere with urinary excretion, for example, the medications that inhibit renin, angiotensin, and aldosterone system. There are certain medications that are used, for example, ACE inhibitors. Now, with that, that cascade is supposed to allow sodium to be reabsorbed and potassium to be secreted. But if such medications are consumed to hinder renin, angiotensin, and aldosterone system from functioning effectively, it can result in the accumulation of potassium. And so when this happens, potassium will be high in circulation, resulting in hyperkalemia. Then another thing too that can cause it is aldosterone deficiency. Aldosterone deficiency, maybe the adrenal gland is not able to produce enough aldosterone for any reason, whether primary or secondary, whatever reason. If there's anything that hinders the secretion or production of the synthesis and secretion of aldosterone, it can result in the accumulation of potassium, and that will result in hyperkalemia. Then the next we are going to look at is excessive release from the cell. Now, there are certain conditions that can allow potassium to be released from the intracellular compartment into the extracellular compartment. For example, we look at metabolic acidosis. Now, in metabolic acidosis, there's elevated hydrogen ions inside of the cell, and these hydrogen ions can displace potassium. And when potassium is free, potassium is displaced from its position, then it is free to leave the intracellular space and go into the extracellular space. And when it does that, it will accumulate, thereby causing hyperkalemia. Another thing too that can cause release of potassium in excess from the intracellular compartment to the extracellular compartment is insulin deficiency. Now, you know that in insulin, when there is as insulin is driving glucose into the cell, it's also driving potassium into the cell. But in a situation where there's insulin deficiency, right, the uptake of potassium into the cell is reduced, right? And so potassium will accumulate in the extracellular space. So hyperglycemia can contribute to hyperkalemia by causing hyperosmolality in the extracellular fluid, and that will increase diffusion from out of the cell, and that will also cause potassium to move along water out of the intracellular space. So that's another one. So insulin deficiency, a situation where there is no enough insulin to drive potassium into the cell. Now glucose will accumulate, and that accumulation of glucose in the extracellular space will attract water from or fluid from inside the cell into the extracellular space. And so when that happens, potassium follows water out, and potassium will accumulate in the extracellular space. Always remember that it is the extracellular um, potassium that determines whether an individual has hyperkalemia or hypokalemia. Another thing too that can cause it is exercise. Now, exercise can cause the release of potassium into the bloodstream by increasing the number of potassium channels in the cell membrane when somebody engage in exercise. So when they engage in exercise in in as in when one engage in exercise in excess, it can result or it can facilitate the movement of potassium from inside the cell to outside of the cell to cause hyperkalemia. Then other causes for hyperkalemia is a massive blood transfusion that can cause leakage of potassium. Now, in blood transfusion, you know that especially if it's not fresh blood, if it's stored blood. Now, when blood is stored, that storage of blood can result in the release of potassium from inside of the cell to outside of the cell, even if there's no breakage of the cell membrane. It can gradually just passively moved from the intracellular space to the extracellular space. Now, that can result in accumulation of potassium. So, when somebody now receives plenty of blood transfusion, particularly stored blood, that can, because of the leakage that has happened in those blood because of their storage into the extracellular space, that blood that the person is taking in is already containing enough of enough of extracellular potassium. You now add that to the potassium already existing in the individual's body, that can accumulate and cause hyperkalemia. So these are the causes of hyperkalemia, and hyperkalemia can be diagnosed by simply measuring potassium level, and then treatment can be done based on the cause of hyperkalemia. So that's it on the series of the kalemias and the emias. So that's it on sodium, potassium, accumulation or reduction. Thank you.